Good afternoon, everybody. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. Aging is a gradual, continuous process of natural change that begins in early adulthood. We all know that aging is genetic and unavoidable natural process. Everyone is going to age. But in today's era, we have came across terms like accelerating aging, advanced aging, due to many intrinsic and environmental factors. We all love advanced planning, but I'm sure none of us would love advanced aging or aging process. All of us want younger looking skin. If you wish you could turn back the hands of time to look younger, it's worth consulting a certified dermatologist to find out what can realistically and safely diminish the sign of aging that bother you. So let's connect today with our skin expert, Dr. Sujatha Chandrappa, live from Bangalore to talk on anti-aging treatment. Dr. Sujatha Chandrappa is one of the most eminent practitioners of aesthetic medicine in India today. An alumni of the prestigious American Academy of Aesthetic Medicine, she has over the last decade specialized in aesthetic medicine as an expert practitioner and trainer, and is today a leading expert in the field of advanced dermal cosmetology and laser applications for aesthetic treatments, advanced non-surgical injectable aesthetic treatments and photo procedures like Botox, dermal fillers, facelifting, skin tightening, anti-aging, LHR, chemical peels, scar, acne, pigmentation treatments, hair loss treatments, and many such aesthetic treatments. So basically, she is an expert of skin, hair, laser, anti-aging treatments. Her clients include not only celebrities, but also men and women from all walks of life, both from India and abroad. She has also trained medical professionals like dermatologists, plastic surgeons, and cosmetic physicians in injectable aesthetic procedures over the years. And today we are going to hear about anti-aging treatments from her. A very warm welcome to you, Dr. Sujatha Chandrappa. It's such a pleasure to have a luminary like you with us. Such a pleasure.
Thank you so much for the warm welcome and your elaborate introduction of my experience and my expertise. Thank you so much.
Thank you, Doctor. And as today we are going to talk about anti-aging treatment, I'm sure all of us do think of this, right? We do
Sure.
want to change the hands of the clothes and want to look younger, and our skin is the one big parameter that actually keeps us or makes us look young. So first of all, doctor, we would like to know, what do we mean when we say anti-aging treatments?
Anti-aging treatments is actually a very big word or a buzzword these days. Now, anti-aging treatments basically means anyone who seeks to improve the signs of aging in their face. So, like as we age, we all need to know the few basic things that we need to bear in mind. Now, as we age, there are different signs or there are different issues that start to happen in the face uh, because of a variety of reasons. Now, the face is going to age at different levels, which means the skin also is going to age, or in other words, we expect what you call as thinning of the skin. Okay. And as we go underneath or slightly deeper down, we have the fat. Now, as we age, also there is volume loss or fat loss from the face. Now, as you go a little more deeper, we have what is called the muscles or the muscle layers. Now, the muscles also undergo aging, which means the muscles are going to become hyperactive as we age. They also become lax. Okay, and also there is a laxity of the ligaments of the face. Also, as we go deeper down, there are the deep fat compartments. They also start to atrophy or lose volume as we age. And also, lastly, we have the bone. There is also some atrophy or loss of bone as we age. Now, as the different layers or the compartments or the different parameters of aging progresses, we see what is called the change in the configuration of the face or the three-dimensional configuration. The structure of the face is totally lost. Okay. The contours of the face are lost. There are certain angles that we need to look at when you talk about beauty. So the angles are lost, the contours are lost, the structure of the face is lost, the three-dimensional configuration goes away. So you start to look a certain way as we age. Now, also at the same time, as we age, we have certain negative emotional attributes or negative emotional messages of the face. Now, what I mean by negative emotional attributes is as we start to age, we start to look tired. Although we may not be tired, we must have just come back from a holiday or a vacation. And, people ask you, or your friends ask you, why do you look so tired?
Right.
Okay, it's because of aging. Now I might sleep for 48 hours, I might take a sedative and sleep for 48 hours. It's not going to go away. Or sometimes, as we age, we might be smiling, we might be happy, but we still tend to look sad. At times, we look angry for no reason. We have had a great day, everything is falling into place, but we might look angry. We might look saggy. So, tiredness, sagginess, anger, or sadness, these are all the negative attributes or emotional messages or unfavorable, what we call as unfavorable messages of the face, which we start to see as the face ages. So anything that can address these issues are basically or broadly categorized as the anti-aging treatments.
You have so well explained, and I think you can read our minds. It's what exactly goes into our minds. We are not sad or we are not tired, but we look so. And you have actually given proper phrase and words to it. So this is what is anti-aging. Now, to talk about anti-aging treatments, doctor, what are the treatment options available to treat aging?
Yeah, there are quite a few treatments available. Now, we have different treatments. Broadly, we can say there are treatments which are based on multiple sessions. We need to go repeatedly to the physician or the esthetician or the dermatologist, whomever you're getting treated with. So if there are multiple sessions, and I think laser is an option available. Now, if you want to just have a quick fix, right? You just want to go back looking fresher or younger, or you have a party just around the corner, or you have an important social gathering you have to attend, and you want to look fresh, you want to look rejuvenated. So injectables or facial injectables is the best option because it's a quick fix. We can see immediate results. So there are quite a few treatments available if you are expecting what you call a quick fix or a lunchtime procedure, and you can go back to your work or your regular activities. You can continue your routine like a normal person. You don't have too many restrictions to follow. So what we have when you talk about a single session based treatment is what we call as Botox. Then the second category of treatments, I would call them the dermal fillers. And then there is a third category of treatment, which is called a thread lifting. So these are all single sessions basically. And there are lasers also, which you need to take a multiple number of sessions depending on what your issues are.
Okay, Doctor, my question is, how do these procedures help to, treat aging process? What is actually done to our skin or our, face or do the things?
Yeah. Like I was talking about Botox. Now, Botox also is a single session treatment, which basically helps to treat the facial lines and wrinkles. Like I just said, as we age, the muscles start to become hyperactive. We use a lot of facial muscles. Okay, so what happens is as the facial muscles become more active, we start to see the facial lines, the facial wrinkles, so on and so forth. So what Botox does is addresses the facial lines and wrinkles, and you end up having a relaxed or a rejuvenated look. So that's how basically Botox helps. Now, the second category of treatments is what we call the dermal fillers, or they are the hyaluronic acid gels. Basically, they are made up of a soft consistency gel, which is called hyaluronic acid. Now, the hyaluronic acid is the best quick fix for all our problems because you might go back to a clinic looking tired, angry, saggy, or sad, or whatever. and you can go back home looking, few years younger and relaxed and refreshed and rejuvenated. So that's what we call the dermal fillers. Now, the dermal fillers are going to help us address the different facial aging signs, like I said, the tired look, the angry look, the sad look, or the saggy look. So dermal fillers are going to help us to address these issues. Now, you can, fill up the under eye hollows with the dermal filler or a hyaluronic acid gel with the filler, and then you can kind of camouflage the under eye hollows or the sunken eyes, and you can look fresher. You can give a nice cheek lift, or you can improve the chin and the jawline contour with the dermal filler. You can look a few years younger and go back home looking far better than the way you entered. So these are all basically quick fixes. Now, there is a third category of treatments, which we call the thread lifting. Now, thread lifting is a technique which takes some time to show the results. Basically, it takes like a month or so for you to get the best results. Although even on the table or on the treatment table, you can see instant results. But over a period of 1 month, it starts to look better and better. Now, how does thread lift help us? Thread lift is basically a polydioxanone thread. It's a material like there were times, the surgeons used a suturing material. After the surgery, they use a thread or a surgical material to suture the wounds. So now basically the same thread is used to lift up the face. It's got various applications. So also it can be used to lift up the face. And these are absorbable threads and they are biodegradable threads. So they are very easy to use, and it gives you kind of instant results, but over the next 1 month, it gets better and better. Now, how do these threads help us? They help to basically stimulate the collagen production in the skin and help to tighten the skin. So you get a beautiful jawline contour. You can treat the nasolabial folds. You can do a little bit of eyebrow lifting with the threads, so on and so forth. So these are broadly the different category of treatments, which are like a quick fix, and they can all be done in just one single session. So just one single visit to a dermatologist or an aesthetic physician is all you need.
Okay, doctor. And I'm sure the viewers are eager to know who all can opt to undergo these procedures.
Okay. Now, anybody who's 18 years or older, anybody above the age of 18 can undergo any aesthetic procedures or anti-aging procedures. Now, there are different category of patients. Basically, the youngsters are what we call as the rejuvenation category of patients, and slightly older patients or the millennials, or what we call the generation X or the Gen X, are the ones who basically come for restoration, because they have started to see certain signs of aging. They are seeing the lines on the face, they're seeing the sagginess of the face, they're seeing all the negative or the unfavorable messages of the face. So these are the ones basically that come for restoration. And the youngsters, or the what we call them, the generation Z's, they're the ones who are on Instagram and Facebook, all kinds of things. They like to take a selfie or do the pouting, so these are basically the patients who come for rejuvenation, and the slightly older patients come for restoration of the aging signs. So anybody who's above the age of 18 can undergo these procedures.
Right. So in a way, we can say that these anti-aging procedures do what our filter applications in various cameras and our mobiles, etc., do to our photo, is what these procedures do to us in reality. That's wonderful to know. Doctor, we would also like to know, is there any treatment available to improve the skin quality?
Yes, there are treatments available to improve the skin quality. Now, the same hyaluronic acid gel is available in a different formulation, which we call the skin boosters. Basically, these are the treatments which are available to improve the quality of the skin. Now, how they improve the quality of skin, I'm going to talk about a little on that. Basically, there are three aspects or components of skin quality, which is the texture, the skin hydration, and the skin elasticity. So the skin boosters help to improve the skin quality in terms of skin texture, hydration, and elasticity. And that's how your skin looks more hydrated or more plump or more soft. Yeah.
Right.
And all the fine lines, sometimes when you smile, you have those little tiny lines on the cheeks because your skin cracks, because there is a certain lack of moisture or hydration. So it helps to address all these issues. Also, it helps to improve the firmness of the skin or the elasticity of the skin. So you go back home looking much fresher because your skin quality has definitely improved. So basically, like I said, the youngsters or patients who are around 18 years or so, they can improve their skin quality to a great extent. It also helps to improve the pigmentation issues or the skin irregularities. Like sometimes you have a slightly irregular skin, because your skin is going to look more smooth or plump. So it also improves the skin irregularities, and it gives you a kind of a stretch, shiny, radiant skin. So that's what we mean by a skin booster.
Fair enough. And doctor, what is the downtime for anti-aging treatments?
Actually, there is no downtime. Basically, we tell the patient there are a few post-procedure instructions we do give them. Like, for instance, we tell them not to go for any facials. Okay, we tell them not to go for any face massages or a steam or a sauna treatment. We tell them not to do any vigorous physical activity or an intense workout, like jog in the treadmill, or work out in the gym. We tell them not to do any strenuous activities or physical activities for up to 1 week. No facials or face massages for up to 1 week. We also tell them to avoid any direct sun exposure for 1 week. But of course, they can go out with the sunscreen because they have sun protection. It is acceptable. Now, downtime, if you ask me, there is going to be slight redness and swelling, which can last for like a couple of hours. Sometimes if the redness or the swelling is really severe, it can last for a day or two, not beyond that. So that can be treated with a few medications or a post-procedure care. But apart from that, there is nothing as such, which we call the downtime. Unlike most other procedures, which have a recovery time or a downtime, they can come to us for a treatment in the morning. They can go attend a party in the evening. They can fly out on the same day. They can go back to their work or their office. So you can even call them the lunchtime procedure. So you go back refreshed, you go back looking much better. But there are no telltale signs because the downtime is virtually nil here. If you're talking about a Botox or a filler, there is hardly any downtime. So it's the best quick fix for your problems. It's a lunchtime procedure. Anybody can do it. Everybody will appreciate that you're looking better, but nobody will know what is it that you've actually done. So it's a great treatment for all your aging concerns. So if you ask me, actually, there is hardly any downtime. We do not actually tell them to stay home. It's like some procedures you do, the doctor or the dermatologist is asking you to stay back home. They say, okay, you cannot go out for a day or two, whatever. But here you can just go back to work on the same day. You can fly out of town. In fact, I have patients who come in the morning and who fly out in the evening. So it's totally safe, and it's effective, and there is hardly any downtime. So these are all the pluses that one would actually look at when considering an anti-aging treatment.
Right. And any other side effects of these treatments, doctor? Some major side effects?
Side effects, if you ask me, they're actually nil. Why I say nil is because I think any treatment for that matter, if it is done in the right manner, if it is done by the right hands, if it is carried out by an expert who has a good idea of the technicalities involved, who has a good hand, who has some amount of expertise, good, well qualified, then it's absolutely safe. But anything can go wrong if it is done by the wrong hands. Because lately, what I hear, why I'm specifying this is because lately what I get to know is there are a lot of salons, and there are spas, and there are parlors, and then there are some paramedics, and then there are some unqualified people, there are nurses. They do not know much about the facial anatomy, they do not know much about the functions of muscles, they do not understand about the aging process, and they are trying to do the treatments because they think it's a quick fix solution. So it basically, if it is done by the wrong hands, there can be an issue. But if it's done by certified and qualified and the expert, experienced people, it's absolutely safe. But also, the patient needs to make sure about the credibility of the treating practitioner, about the qualifications of the treating practitioner, about their success rates, which is very important, about how well they're experienced to deal with these procedures. So one needs to bear in mind that they have to check on the treating physician before they make a final decision. But products per se that are used for doing these treatments do not have any side effects.
Right. So we need to focus more on going to the right person, which is a qualified
Absolutely.
dermatologist or, a skin physician, aesthetic physician like you. Now, what happens, as you have very well mentioned, there are so many quacks. There are influencers on social media, and we tend to fall prey to them. Plus, doctor, there are so many anti-aging products in the market. We many a times, feel that why to go for certain procedures when we have these anti-aging products, and we go for it over the counter. We don't even go to any dermatologist to ask for it. We'll just buy and keep on trying. And unless and until we realize that it has done more harm to us than any benefit, that's when we go and land in front of a dermatologist. So, what would you like to say about this?
Okay. Now, I get all kinds of patients. There are patients who come and tell me that I have these lines or I look old for my age, and give me a cream or some serum which is going to fix my problems. And social media has a big role to play here because they come up with so many endorsements or advertisements that kind of is very misleading, and that's not what I call responsible advertisements, because they promise the moon. So, as a responsible person, I would like to tell my patients that you can use them forever. You can drown yourself in a bottle of cream or serum, but it's not going to really make a big difference. The maximum that you can expect out of these serums or creams or whatever topical application products that we have, which promise the moon, is maybe your skin is going to hydrate a little bit. Maybe some 10% improvement you might have in the quality of your skin. Maybe the pigmentation will lighten a little bit, or your skin will look a little bit hydrated, or so on and so forth. But expecting it to work like an anti-aging treatment is something that's not going to happen. They tell, oh, you know what, I haven't slept for last 2 days, or whatever the case is. But I tell them that, look, even if I sedate you here for 24 hours and I put you to sleep, you're not going to go back or wake up with your under eye hollows gone. It's not going to happen, because there is fat loss or volume loss from the under eye area. So it's not going to get filled up if I sleep or sedate myself for 24 hours. I might drown myself in a bottle of anti-aging cream or serum, but aging is not going to go away because it has happened over the years, right? So just a cream, see, all of us are going to age. All said and done, everybody ages. But what really works is a treatment, and not a bottle of serum or a pot of cream. It's none of those work. Maybe, like I said, maybe 10% they're going to improve your skin quality to a certain extent, but it will not correct the aging signs, because your muscles have, overworked over the years. Your fat is gone from the face. Your bone is atrophying. Your skin has become thin. So how do you think a pot of cream can correct everything? So practically, logically, if you think about it, the only quick fix or the only thing that works is a treatment.
True. So please,
Right?
viewers, don't fall prey to any market gimmick or influencers, etc. Go to the right person. That's really important. Go to a qualified dermatologist and aesthetic physician, right? And doctor, as we are talking about anti-aging treatments, how often does the patient need to repeat these treatments?
Okay, that's a great question. Now, different treatments have got different longevity. Now, if you talk about Botox, for example, the repeat rate is 2 to 3 times a year because it's going to last us for about 4 months. Now, the dermal fillers will last you for about 1.5 to 2 years, depending on what product has been used and what brand has been used. Brand, when I say brand, I mean the company where it has been purchased or procured. So it can last anywhere between 1.5 to 2 years. And then we have thread lifting, which can last anywhere between 1 to 2 years, depending again on the brand that is used, depending on the variant of thread that is used. When I talk about thread lifting, there are varieties of threads. We have the mono threads, then we have the cork threads, then we have the screw threads or the cork screw or the double screw threads. So that varieties of threads. So it's going to last us for anywhere between 1 to 2 years. So every treatment or every product has a certain amount of longevity. So, but I would say if you were to broadly categorize it, it will last anywhere between 6 months to 2 years. And once the treatment effect wears out, you need to go and repeat it. It's like, there are times when patient ask me, do something to me that's permanent.
Mhm.
I give them a simple example. I tell them, you go to the salon, you cut your hair, right? After a certain time, you need to go back and, do your hair again. It's not going to last forever. So it's the same thing with these treatments. It's definitely a quick fix, but it's not going to last forever. It's not going to last us a lifetime, right? So they need to bear that in mind, because many times they get something done from elsewhere and they come and tell me, oh, I did Botox, maybe a few years back, it didn't last. Because they had a certain idea in mind, they thought it's going to last them forever. So, and then they say, oh, I got it done 2 years back. It's obviously not going to last. So they need to bear these things in mind. So, and depending on what treatment has been done, the physician or the esthetician is going to advise the patient about when she needs to come back for the repeat treatment.
Okay, doctor. And doctor, are there any long-term benefits of doing these anti-aging treatments?
Yes, absolutely. Now, what happens is if I look at my patients who I've been practicing aesthetics for over a decade now. It's been almost 15, 16 years that I'm into aesthetic field. Now, when I look at a patient who has been getting aesthetic treatments or anti-aging treatments from me for at least, let's say, 10 years, and let's say they're like 50, arbitrarily, they're 50. They tend to look much younger than a patient who's actually 50. So they would like look somewhere in their 30s or late 30s. At the same time, if you look at a patient who's 50, I'm glad if they look 50. But if they look 50 plus, it's not acceptable, right? It's not favorable, rather. So one needs to look their age or better than the age. This is my take on the whole thing, on the whole subject, because if you look older than your real age, it's not acceptable. So I think the whole idea is to age gracefully. For many people, or many of my patients, what aging gracefully means is just lead your life the way, you're born with, or just continue to age the way, your life takes you. But what I mean is when you age gracefully or you look younger than your real age, it's a plus or it's an advantage, because you have a lot of self-confidence, you have a lot of self-esteem to talk to people, because I have all kinds of clients. I have even housewives. I have even patients who are still students, who are like 18 plus, because their mothers get them here. They want to look better. So they are uh, around the age of 20 or 20 plus. At the same time, the mother is going for a restoration treatment. The daughter is going for a rejuvenation treatment, right? So it's all about aging gracefully or aging the right way. There's no fun if you're like 50 and you're looking 60, there's no point. So I feel that definitely these treatments help, and my patients who are on these treatments look far younger, far better than the patients who are not on these treatments.
Right. So aging gracefully is the key word. And definitely we can take the help of these anti-aging treatments as they are absolutely safe and also have long-term benefits. Doctor, are there other issues that can be addressed with these treatments?
Yes, absolutely. Now, patients who are 18 years or slightly above 18 years, they don't have too many aging signs. They come with different kinds of concerns. Now, in comparison with the patients who are the baby boomers or who are the millennials or who are the generation X's. Now, these are the patients who come basically for restoration, or what you call as the repair job, right? Whereas the youngsters are the ones, or the patients who are in their early 20s are the ones who come for basically four issues. They want to look younger, they want to look attractive, they want to look more feminine, or they want to look more contoured or more structured. They want a sharper jawline. Okay, they want all the beauty angles. They Google a lot, they search the golden beauty ratio. There is a golden ratio which is 1 is to 1.618, and they have read so much, they say, where is my 1 is to 1.618 ratio? So they try to fix that. So they look more contoured. And the fourth issue is they want to look more feminine, right? So more attractive, more younger, more contoured, more feminine. So these are the four issues that they want to address. Now, again, when I talk about these four issues, there are various kinds of jobs or treatments that we could come up with, which is a non-surgical rhinoplasty, like they want a sharper nose, they want a more slimmer nose, or they want the tip of the nose raised, or they want more fuller lips, or they have a droop at the corners of the mouth, they want a nice smiley, so, or they want an eyebrow lift. So these are the different concerns, so which could fall into any of these categories, which means younger, attractive, contoured, or feminine. So basically all these issues, like a fuller lip or an eyebrow lift, or a more contoured jawline, or a nice slender neck. So these are the various issues also that can be addressed with these treatments.
That's amazing. And Doctor, now I'll take the questions of our viewers. So we have Yash Namdev with us. And okay, so his question is, are there any specific skincare products or ingredients that you recommend for 30 plus?
Now it depends on what the concern is.
Mhm.
Okay, and it depends on what is the skin type that they have. It depends on what is it that they want to address. But at the same time, I can give you a fair idea or a fair knowledge about what are the things that one need to look at when they're buying a product for their regular use. First and foremost, they need to use a face wash which agrees with the skin type and the skin condition. Secondly, they always need to make sure they use the right sun protection, which can be an SPF 30 or an SPF 50. So again, depending on the skin type and the skin condition. Third thing is they can always use a product which is a night cream or a night serum, depending on what skin issues they have. Now, if we are talking about a night skin or a night cream, they could be various depigmenting agents. If they have a pigmentation issues, there are various depigmenting agents, like we have the kojic acid, arbutin, we have vitamin C. Then, there are different kinds of skin lightening products which can be used overnight. Also, if they just want to refresh or rejuvenate the skin, they can use a great serum of hyaluronic acid and vitamin C combination, or they can use a retinoid cream overnight, which is a good for anti-aging. It also plays some role, but it's not like what a treatment can do, but definitely they will improve the skin to a certain extent. So they can use a retinoid cream if they have aging issues or they just want to look fresher. If they have a pigmented skin, or if they have a dry skin or a dull skin, they can use a moisturizer, which could be a mixture of different moisturizing agents or emollient agents. So there are different preparations or products available for different skin issues based on the skin type again and the skin condition.
Fair enough. We also have Jeet Chaudhary with us. His question is, what are the key factors that contribute to premature aging? And how can I minimize their impact on my skin, doctor?
Okay, all of us age. That's a blanket statement to make. No matter
Right.
what we do, we're going to age. But at the same time, that doesn't mean we just let ourselves go. Okay, I mean, let things take their toll on our skin and on our aging process. The least we can do to talk about is use a good face wash, use a good a night cream or a night serum. I recommend serums highly because of the certain properties that they have. The penetration or the absorbing capacity is far better than a cream. So night serums, if I can say, and then a good sun protection. Now it can be SPF 30 or 50. And also, now there are different, we also need to bear in mind what is it that causes the aging or what is that accelerates the aging process. Like this person just asked us, what are the factors that are going to accelerate the aging? How can
Right.
I, kind of control my aging?
Mm.
So, so there are different extrinsic and intrinsic factors, such as genetics. Genetics have a big role to play because our parents and our grandparents aged a certain way. We could also age the same way, maybe, may not be. It depends on genetics. Now, again, sun damage can also play a big role in accelerating the aging process. Then we have certain other factors such as diet. All of us know how important it is to eat the right food,
Mhm.
and lifestyle, which means a certain amount of physical activity is recommended on a regular or a daily basis so that we can have a better skin, or we might not age as much as the others do. Also, it's very important to have good sleep, and also at the same time we also have certain medicines, like if you have certain medical conditions, if you're on certain medications, they could slightly accelerate the aging process. So these are all the factors which some can be controlled, some cannot be controlled. Like genetics, we don't have, it goes without saying that you cannot modify
Mhm.
what genes bring to us or how they impact our aging process. But
Right.
some at the same time, like having a healthy lifestyle, eating the right food, sleeping well, meditation, exercise, sun protection, all of these are in our control. We can definitely modify our lifestyle in a way that we do not age as much, or we do we act we there are no factors which can accelerate the aging process.
Okay, doctor. And one more question from Ravi Kumar. Are there any pre-treatment preparations or post-treatment care instructions that one should follow?
uh, Now it depends on the treatment that the patient is seeking.
Mhm.
Now different treatments have different procedure instructions, but pre-procedure instructions, there is nothing. You can just speak to the concerned physician depending on what treatment they are doing. As such, there are no pre-procedure instructions, but post-procedure instructions, there are a few, like we tell them not to go directly expose their skin to the sunlight. Direct sun exposure for at least 1 week is a big no-no. Even otherwise, direct sun exposure is a big no-no. We
Mhm.
always ask them to use sun protection regularly and at least every 2 to 3 hours. That is one thing. Second thing is we tell them to not do any intense workouts or physical activities for a week after the treatment. No facials or face massages for up to 1 week after the treatment. No steam sauna for a week after the treatment. So these are the few post-procedure. Pre-procedure instructions, there aren't much that I can talk about.
Okay, doctor. And doctor, before we sum up the whole session, any take-home message for our viewers?
Um, yes, I think a big message that I would like to kind of help our viewers take away from today's talk is that if they think that aging is something that can be fixed with a pot of cream or serum, it doesn't work that way. There are many patients who are kind of misled or misguided into thinking that because no matter what I prescribe, it's not going to work. Like what we see on screen is not what really happens in real life. Anti-aging creams and serums, there are plenty. They help to a certain extent, but they do not address the unfavorable messages of the face. They do not address the aging signs. They have a very limited role to play. So let's not get misled by these things. Let's opt for treatments. Let's do the right things and keep ourselves looking younger and better.
Okay, doctor. Thank you so very much for your valuable time. It has been a very informative session for our viewers, and it was wonderful hearing you. Thank you so very much, and we really look forward for many more such sessions for our viewers in coming times with you, doctor.
Thank you so much. Nice talking to you.
It's a pleasure, doctor. And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Stay happy, stay healthy, stay spotless, stay beautiful, and keep glowing. Thank you. Goodbye. Have a good day ahead.
Thank you. Bye.